Hey, it's Scott, and I'm here at Miami at a disaster medicine conference. And this morning, we're lucky enough to have been joined by Wendy, who is an epidemiologist from the Florida Poison Control Centers. And in this week's Gimme Five, we just want to go ahead and touch on the whole idea of carbon monoxide poisoning.
Absolutely. So carbon monoxide is really one of the most important substances of concern in terms of fatal poisonings. And the connection to disaster medicine is that we see the poisonings and the fatalities happen very, very rapidly after storms. So we saw after Irma, for instance, locally, we had about 100 cases that were hospitalized and or dead in our county. And we didn't even we lost power, but we weren't hit hard by the storm. Like the Keys really were hit hardest, but we lost power. And as a result, people fired up their portable gas-powered generators in ways that were unsafe. So we saw those hospitalizations and those poisonings peak just 3 days after the storm.
So that quickly.
So fast. And of course, the fatalities happen, within hours. If someone is using the generator, inside the home or even too close to the home, we see these happen really fast. So one message for hospitals is if you have a community outreach program that is out there in the community talking about preparedness, getting ready for storms, we want to make sure that people are including messages about having carbon monoxide detectors. And so we had this one, this is a little portable one that you can take to hotels as you travel, but there are also other modules that plug right into the wall, which is nice. So it has the battery, of course, for when power is down, but on a normal day, it's getting power from the wall. And then just also educating community members about safe generator usage.
Now, you brought up the idea of hospitals doing outreach with this. It seems like on the fire service side, that the majority of fire services will go out and do smoke detector checks, they'll do fire, obviously prevention, and they'll do carbon monoxide tests, as well. But when it comes to these, you brought up an interesting idea, which honestly I had never heard of. And have you found people who actually travel with these when they go to a hotel? I imagine in our family, we have it in our house in various rooms in the house. But I personally never heard of somebody actually bringing one on the road with them.
Yeah, well, there have been a few fairly high-profile cases associated with hotels, including one in the Keys where there was a fatality, and it was, something so innocuous. I think a bird had built its nest in the flue of the boiler, and the levels built up, and it was an older hotel. It didn't have a carbon monoxide detector, so it's happened. It's not common, but for frequent travelers, I think it's worth having. This was very inexpensive. There are a lot of different types. Some people have one on their keychain, which is nice also for vehicles,
wow,
right?
Okay.
So yeah, a lot of different choices now. So it's just a good option.
So two other quick things as we finish up this one. The first one, as we were talking this morning, is about children versus big people. Mm-hmm. And essentially, is there a big difference in regards to who does carbon monoxide kill? Is it specifically kids versus big people, or as you described, a whole family?
It tends to be the whole family. I would say that children are impacted faster in that their carboxyhemoglobin level can rise faster because of their rapid respiratory rate and their small size, right? So their rates are gonna go up faster, but when a generator is operated in a dangerous condition, it happens so quickly that basically you get a whole family incapacitated, and if no one reacts, you can see the whole family taken out. So, I do think certainly, of course, we consider children as vulnerable, I would say, and children are more likely to need, say, hyperbaric treatment than adults, who sometimes are fine with room air or with oxygen. But yeah, in general, we would consider pregnant women and children more vulnerable
Sure.
to long-term harm or death.
The kid thing, at least to me, initially makes sense. They're tinier creatures, and they breathe faster.
Yep.
So if you're sucking in something icky and you're breathing a whole lot faster than your big people counterparts, it's going to mess you up a whole lot faster.
Yeah.
And you touched on the whole idea of hyperbaric. In the medical world, it's pretty controversial. We know that it works for diabetic feet.
Yes.
And we
Wound
know
care.
that if you're down in the Keys and you pull them off of the ocean floor with the bends, it
Dive
absolutely
medicine.
works.
Yep.
And at least from my understanding, when you read through the literature, some people swear it works for carbon monoxide.
Yeah.
Other people swear it doesn't work for carbon monoxide.
It's not for everyone, certainly, right?
If you've got it, from what I've read, a lot of people say if you've got it, absolutely feel free to try it.
It's not magic. I know our medical director described it basically as just shortening the period, sort of buying the brain some time. And really, we looked at, again, the data from IRMA, and it was really only about 12% of the cases where there was carbon monoxide poisoning were recommended to be treated
To
with
actually get dove.
Yeah, so it was certainly not everybody, which is good because the capacity is generally not there to treat large groups of people, unfortunately. But yeah, if the idea is to get them back to normal levels, get the oxygen circulating as quickly as possible, hyperbaric might be a good option, and poison control centers can advise, as to which patients could benefit from it and which really there's really no reason to go through that extra step.
There really is kind of an interesting idea just you brought up about if you have somebody, again, when you play with poison control, you think about people who get a hold of something.
Yeah.
But to go the route of calling for carbon monoxide, it's carbon monoxide poisoning. So by definition, having poisoning and poison control in the same sentence kind of makes sense.
Yeah.
And again, if you said 12%, I think it was, is who they recommended to go in a chamber.
Yeah.
That's important for both EMS and for the hospital side, because that means 100% of the time what they recommend to start with is just boatloads of oxygen, because you remember that carbon monoxide has 230 times the affinity for hemoglobin that oxygen does. That's
very sticky.
Really impressive.
Yeah.
So the whole idea is you put them at 100%, you put them at 100%, you put them at 100%. But then again, if you've got poison control or whoever your other expert might be that says, you know what, hyperbaric is an option, great. So the other thing we wanted to quickly touch on is not only the idea that some people are actually now bringing this with them, but the whole idea of changing them.
Yeah. So we do have, they only last, even the ones that are hardwired, to your home's power, they only last about 10 years. And so we've gone through that cycle in our home, and they started all going off at the same time, and we were like, okay, we're gonna die. What's happening? And we had installed them all at the same time, so they all went bad and we had to replace them. So, so in general, you have that 10-year window for a new CO combined smoke detector. But it is recommended that when we change the clocks twice a year, you do check the batteries, because you do want, not only, even if it is plugged in or hardwired, you want it also to have those backup batteries.
Right.
So, yep, exactly. So twice a year, you check the batteries, make sure they're still functioning. It's just a nice way of remembering to do it.
Right, just like you said, just an easy way, just every 6 months, to go ahead and just change the batteries. I've heard people say check them. I've heard other fire professionals say, you know what, just make your life easy, it's a battery.
That makes
just
sense.
take it out, put it into a battery, because prevention is certainly preferred when it comes to pretty much all things poisoning.
No, it really is, and because these happen so fast, and I think the symptoms for people who are experiencing a poison are very vague. So, people are always saying, oh, tell us what the symptoms are going to be. And I'm like, by the time you feel symptoms, one of the symptoms is confusion and disorientation. So at that point, you might not be able to connect what's happening with you to the exposure. So we really want people just to understand they need to be operating the generator, not just outside the house, but CDC recommendations is 20 feet from the house. 20 feet is a really, really long distance. So again, the IRMA data, when the health department sort of looked at who was getting poisoned, the average distance of the sick group was 8 feet from the house.
Oh my gosh.
So yes, we had some fatalities. Those were inside the house, but we had really, really sick people who thought they were operating the generator safely. And then the other thing was, there was another population in that group, the sick group, who were operating the generator at 14 feet, but because they had an air conditioner running, it was pulling the gas
like a
into
perfect storm
the
type
house.
situation.
Exactly. And so, we live in a very urban environment here in Miami, and so there are many lots in our dense urban core that are simply too small and too built out to operate a generator safely. And that's something I think we need to address more in terms of like an ordinance or municipality level. Everyone is not entitled to a generator. And so we've got to do more to help people sort of understand the safety limits of these post-storm steps we take.
Perfect. As always, Wendy, thank you so much. And we'll see you next week for our next Give Me 5.